Welcome to the Living Medicine podcast, where we talk about ethical medical use of psychedelic psychotherapy, teaching skills, examining the issues, and interviewing interesting people. Now let's start today's show.
Hi, everyone. This is Dr. Sandy Newis of the Living Medicine Institute, and I'm sure that you all are aware, but Living Medicine Institute is a business where we provide for clinical and medical providers, where we provide training, content, and resources for providers who are interested in learning about psychedelic-assisted psychotherapy with a specific emphasis on ketamine. And I am delighted to have Veronika Gold here from the Polaris Insight Center. I'm really happy that she was willing to do this, and I'm super grateful. So thank you so much. For those of you who don't know, which may or may not be very many of you, Veronika is one of the co-founders of Polaris, which is really not the first ketamine-assisted psychotherapy training program, but one of the earliest, and serves a tremendous amount of people. I myself did the trainings when I was really early in the field and learned a ton. And one of the things I really valued and appreciated about it was the specific focus on clinical interventions, theoretical application, and that just felt like it was really taking that to the next level. Veronika has also been really just influential in the field. She presents, she writes, and also was one of the MDMA therapists, so in the clinical trials. And how many years did you do that?
Good to be here. And so I've been working in the MDMA-assisted therapy trials for since 2016, since 2017. That's 2016 we got training. So
well, that's a really long time. And so, and we've all been through a lot of different waves of the psychedelic assisted psychotherapy field since then. And so, today we're going to just talk a little bit about, Veronika, I'm going to ask you kind of who you are in the field and how you got here, and then tell us a little bit about Polaris, and then some of the kind of interventions that are utilized in ketamine assisted psychotherapy, and then maybe kind of a discussion of some of the MDMA comparison and some of the associated things. Does that sound okay?
Sounds great. I'm delighted to be here and grateful for your work and the support of the field and all the information you're bringing to us. So thank you.
Well, thanks. So, the first question always is, just tell us a little bit about yourself and, kind of who are you in the world and how did you come to be so central in the psychedelic field? Just tell us a little bit about your journey, about how you landed here.
Yes, so I'm a marriage and family therapist. I'm licensed in California and Oregon, and I am originally from the Czech Republic. So I was a psychologist back there, and that kind of led to this direction in my life. So when I was just 16, I met Stanislav Grof, who was one of the co-founders of transpersonal psychology at a transpersonal conference in Prague, and got involved in holotropic breathwork and had a lot of my own healing and my personal process with healing and therapy, and that kind of led to my already deep interest in human relationships and psychotherapy and becoming a psychologist. And when I came to the United States, I got my training here and was really interested in the treatment of trauma. And so a lot of the training that I've gotten over the years was focused on the treatment of trauma. So I have a lot of somatic modalities and transpersonal techniques of working with trauma. And so I work as a therapist at Polaris, as you mentioned, and as well work as a supervisor and a trainer. And with the MDMA clinical trials that now are over, but I worked with MAPS and then Lycos as a therapist, co-therapist on the clinical trial, and then also as a supervisor, consultant, and educator trainer for the MDMA-assisted psychotherapy. So working with non-ordinary states of consciousness and seeing the potential for healing and transformation has been passion that kind of led me through my own healing and the work of psychotherapists.
That's so interesting. So this is going to be a little bit of a sidebar for a second, but just, you mentioned non-ordinary states, and that's something that I'm really interested in and talk a lot about. I don't think it's just medicine. I think that non-ordinary states are found in a lot of domains like wilderness and meditation and breath work and, a really dance. And I'm just curious, what your thoughts are about that.
Absolutely. So, non-ordinary states of consciousness or expanded states of consciousness, holotropic states, it comes from, holotropic breathwork, um, meaning moving towards wholeness. So that there are these states that give us kind of a greater view, greater ability to connect to ourselves, to things around us, and kind of open this greater possibility for healing, um, understanding, insight, processing, releasing, and um, and those states have been, the oldest technologies or ways of healing for indigenous people all around the world, and for personal healing, for mental health, but physical healing, but for different community situations, for transitions, and so here we are working with these states in Western psychology and psychotherapy, which is very exciting. And I also think it's a big responsibility. So it's important that there is a lot of training and information, and that we are kind of aiming in doing it in the most integral and ethical way.
I agree. I mean, I love that you said that, we can essentially do harm, right? That, I mean, sometimes that's just an understated kind of thing. Excuse me, especially I think in ketamine, where people can do it without a therapist and they can do it in a different, domain. And I think it's really important that people are aware that you can do harm and that there are things to learn, and it's important. So yeah. So tell us a little bit about Polaris. Actually, I want else to just say, like, I'm always kind of like, you got to study with Stan Grof. Like, I mean, like it's like all roads like lead to Stan Grof, like I've read about him, and I went to the MAPS conference, and I just kind of like tried to stand near him, just like, and I know that sounds really funny, but just putting it out there for people, like really, I mean, he's so much kind of the, one of the originators of this, and highly recommend just reading about his work. And that must have been a really powerful experience.
So for me, it was at different times of interacting with him, and he spent some time in Czech Republic, Czechoslovakia after the revolution, but by then he already lived in the United States, and so I got to spend some time with him in Czech Republic, where after 1989 he came back and was doing trainings and a lot of holotropic breath works. And so I met him and his students who were also teaching there. And then, many times met him here in when I moved to San Francisco and Mill Valley. And, some people talk about this way that he, that sometimes like you just met Stan and that changed the direction of your life. And I kind of feel that there was this inspiration, and then learning about his work, reading his books, experiencing breath work, and then also studying with his students, that were some of the early therapists on the MDMA-assisted therapy trials, Michael and Eddie Midhofers, and of course Rick Dublin. And so so I feel very grateful and so much gratitude to Stan. Absolutely.
Wow, that's Michael and Annie said the same thing, and so have several other people. So we just always want to kind of like note, right? There it is again. So I certainly appreciate his influence. So how about, could you tell us a little bit about Polaris? Like, when did you found it? Just tell us a little bit about the evolution, what y'all offer. And then I'm going to probably kind of ask you some about just the general clinical process that you all teach.
The co-founders of Polaris through the MAPS and DMA training. So we were kind of placed in the same Airbnb together. And, right away, it's kind of like you meet the people you've been waiting for. And we just had so much alignment and passion and long history in the treatment of trauma. And so we were trained, and we were starting to work on the study. And we've been also learning about ketamine work from our colleagues um, who've been doing that work. And so I started working at an infusion clinic where I got a lot of experience with ketamine, with the process that the patients were going through, and kind of from there we co-founded Polaris. So we spent a lot of time meeting, about 6 to 8 months, just envisioning, processing, kind of exploring the values and the way how we wanted to bring the work forward, and then started a small clinic in San Francisco. And then, everything grew organically. So there wasn't originally a plan to have other therapists working there or having a training program, but it all kind of evolved as we started to do the work. And so right now we still have the clinic where we work. We have several wonderful therapists. We have 2 MFT associates who work with us, and then we have the training program that is a combination of in-person and online training program where people take modules, and even the online, everything is live. So we think that's one of the kind of I talk about like 8 pillars of becoming a psychedelic therapist, and so that there is a lot of online learning that is, and book learning that is important, but then also having kind of this Q&A possibility, and learning in person, and then having experiential retreats. So we believe that it's important to learn through self-experience, and it's with ketamine, but also doing personal work. That is kind of the first pillar of being in psychotherapy, knowing oneself, and then having experience with the ketamine if you're going to work with others. And so we do supervision also, and just kind of like expanding the field. And so we last year had two special trainings, where one was together with Dr. Chris Beige, and then the other one was kind of bringing medical providers, mental health providers, and spiritual providers together. So there was chaplains, clergy, kind of coming in together, doing a training in ketamine-assisted work.
Interesting. We are also beginning to do some work with clergy and kind of moving in that direction. It's a pretty interesting kind of world when we start talking about some people being really concerned about, it being some kind of portal to allow in, negative energies. And is that really in alignment with religious philosophy? And others are like, oh my gosh, this is exactly it. I don't know if that was your experience or not.
It wasn't our experience in the training, but there was definitely conversations about that. And, and I think there's different ways how we can think about, what that means really, and what are the concerns, and what is kind of the remainder, or kind of the impact of the war on drugs, and a lot of the misinformation. And then also there is, as you said, there are negative experiences that people have because of unsafe set and setting, or from not having providers who are well trained. And then there is the material that emerges, and then there is this part: how do we create safe space that people can have these experiences? So I think it's always good to question the psychological, physical, and spiritual safety.
Yeah. Yeah, I just think it's very interesting just to kind of continue to have these conversations outside of the psychedelic field, because there's a lot of concerns, and people are bringing up a lot of things, and those who are in the field are like, this can be amazing. Let's do this really, really well. And I mean, that's kind of an interesting sort of, thing happening out there in the world. And I just think that's something that people need to be aware of. And, I might ask you about that again in a minute, but just like knowing that, like, if you're a proponent of this and you want to do it well, there is a world in which people are talking about this, but not the whole world is. Like, like, do you see that? I said sometimes I was like, yeah, I talk about psychedelics like all day, every day, but then I lead this and I'm like, but others don't. Like,
I just was in Arizona, and I talked to this man who was working actually as a counselor in this ministry, and he never heard of ketamine or ketamine therapy. So it was great to kind of come out and also see the excitement of the possibilities that are there. So education, information, and training. It's how our training program started, because we were um, doing consultations with primary therapists of our clients. And so
yeah,
the clients who come to work with us, they have a primary therapist that, because we do see, even if, you do multiple ketamine sessions, it's still short-term intervention. And so the psychotherapeutic process might be for a year or longer. And in that time, the person might do 4, 6, 10 ketamine sessions. And so there is always this close collaboration with the primary therapist, unless the ketamine provider is also the therapist. And that's kind of how the program that we offer started, because we were offering these trainings and having these conversations with therapists.
Well, people don't know. Like, I mean, that's just an interesting thing. Like, I mean, it's for people like you obviously know this, but there's ketamine treatment and then there's ketamine-assisted psychotherapy, and while they both have the medicine, they're not the same. And in the ketamine treatment world, they make pretty broad claims about mental health issues, but there are adverse events, like where content comes up or people have a disturbing experience and then they don't have any place to land with it, which is exactly the power of the medicine. Um, I'm just curious, kind of, what your thoughts are on that and what message you'd like to communicate about that.
I see so much, as you're saying, advertisement and kind of claims that are being made, and people who are struggling, like find these hopeful messages, and and then they don't know all the difference what is available. And Dr. Raquel Bennett talks about these paradigms of treatment, which I think is really helpful way of looking at this. That there is the medical paradigm, which is really looking at the neurobiochemical effects of ketamine.
Right.
And so that's kind of where a lot of studies are done. But I, always kind of think about even like the question of the studies where they're really looking at symptom reduction. And just when we think about the types of trauma or types of depression that people might have, or the causes of it,
Yeah.
and then the symptoms are kind of measured just in maybe 2 weeks after, or in the end of the treatment. But when we are looking at ketamine assisted psychotherapy, it's of course getting the benefit of this neurobiochemical effect of ketamine, but also we are looking for processing the underlying issues, for actual shift and healing, and so that the results and the shift is long lasting.
Yeah.
And the primary there is the
Mm.
relational part, so that the ketamine is a catalyst of that relational process, so that there is the psychotherapy, there is the relationship between the client and the therapist, and then the ketamine comes, and there is the relationship with the ketamine that's then supporting the treatment. And so it's important that the therapist is trained, is present, um, and I think has their own experiences with ketamine,
Yeah.
so that they can guide and provide psychotherapy. So they are
Mm.
still engaged in the process with them,
Yeah.
and then there is a transpersonal paradigm where um, the focus, or the transpersonal experience, the psychedelic experience, is seen as crucial for the healing process. And
Mm.
again, in that you can have the psychotherapy and the neurobiochemical effect of ketamine. So it's kind of a combination of them. But I think what you're saying, or what you were asking about, is that there are places where you can get a ketamine infusion, or you have mail-in lozenges, but there is no support, there is no therapist, or there is maybe a sitter who um, is not really involved in that relationship and is not providing psychotherapy. So it's like a ketamine experience. with
Well, and
support.
it's interesting. I mean, one of the things I think is interesting is that, I mean, we don't get more adverse events reported under those conditions, which I think speaks to the safety of the medicine. But it's also kind of a shame that people don't really realize, like, that there can be so much more. And I think one of the things I wanted to ask you is you've mentioned the relationship. And I remember that from early on, like when I did the training, which was a long time ago now, about, yay, we get to talk about the relationship because I was trained in that way as well. Um, but there's still a prevailing view that it's not that relational of intervention. Like we're going to do like higher dose and we're going to sit there quietly and then we might process afterwards. But it sounds like you really advocate for the opposite of that, which I certainly do. And we do at Living Medicine Institute. So I'm just wondering if you can talk about the importance of those relational pieces, just like, the being with the client and working with attachment and relational aspects, especially as they relate to trauma.
Relational part is that the ketamine is brought into the psychotherapy. So the client is coming and the relationship is creating or supporting the safety that the client will feel. And my colleague Harvey talks a lot about this, like, what does that safety mean? Can we make somebody feel safe? And really, it's, can the person feel safe with us to feel unsafe? So that we are creating a space where everything is welcome, so that beautiful, challenging things are welcome into the process, and that then they're held and healed through that relationship. And and then the ketamine work is part of this process. It expands the consciousness and allows, there is a lubrication of the psychotherapeutic process. And then it also brings kind of access to material that has not been accessed otherwise. And, gives this kind of greater perspective. And so, you can just be there and witness and keep the person safe, kind of, you're monitoring them and they're going through their journey. And the way we work is we talk about an inner directed psychotherapy. And so it is like we are engaging, and when the ketamine is on board, the therapist is also kind of bringing in this beginner's mind. We are there and allowing for the process to emerge, but then we are engaging as something emerges. And and it might look even as something simple as repeating to the client what they said, or just noting something, asking a question. So it looks definitely differently than regular talk therapy when they are under the influence of ketamine, but the therapist is fully present the whole time, and there is this back and forth, call and response. So when the client says something, I will, acknowledge it. I will make a sound, or I'll repeat a word, and I ask them. And sometimes it's more active because they might encounter something was challenging and they need a little bit more support and guidance to move through that. But again, the principle here is a little different, that we are encouraging them to move with what is coming up. So kind of being curious. That's kind of the biggest, I think one of the big principles is to bring curiosity and look at whatever is emerging in that state, and that's where the relationship is. And then of course it continues into the integration process and like the preparation for another ketamine session.
I love that. I kind of coach my clients on suspend the need to know. Like we're not looking for the aha moments necessarily. Like we really want to stay just in curiosity, stay in the inquiry. Like we're not actually searching. I mean, I call it the aha moments can emerge, right? Like sometimes we're like, oh my gosh, but really it's different. Like I think that's one of the critical differences. I'm just wondering, do you agree with that, or any thoughts on that?
Yeah, beautiful. I love how you say it. And exactly, it's like kind of coming from the mind into the body. Having like and Stone talks about it's healing through the experience itself. We don't have to understand what's happening even, and the shift can happen. So kind of coming back, being with what is emerging, and of course, it's difficult for many people, and probably many of us at times, where the mind wants to understand and wants to figure it out and what it means, but it is a way of moving away from what is actually happening. So how can we be with the process present, curious, and there is time where we kind of invite more kind of what are the insights you're taking away and how it's emerging in your life, and that kind of continues to unfold. But during the session, um, it's a great invitation and practice to kind of go out of the mind and not having to know, not having to understand. Mhm.
It's interesting because it's a parallel to mindfulness, right? That you're like out there in the world, especially kind of afterwards. Like, can we stay in that curiosity in our lives? Like, of course, we're just human and we're doing the best that we can. But I do find the clients want to like button it up. Be like, okay, well, no, this is what I learned about that. When really, what if the learning was actually about the state and was actually about the relational component and being able to stay in curiosity? And it wasn't so much about realizations. Right. I mean, that's a piece of it, but I think there's more to it than that.
Getting to know ourselves, like it's for the client, for them to know themselves, with themselves, in a relationship to themselves, in a relationship to another, which will be the therapist, and then the world.
Right.
And um,
Yeah. Yeah. So you, from what I understand, I mean, well, I know because I was there and I've heard you talk about it before, but pretty big advocate for somatic interventions, and somatic interventions don't always involve touch, but often do. Um, so I'm just kind of curious. You advocate for the use of touch, but that can also be controversial, and so I'm just curious what your thoughts are about using that safely. Where do we need to go with that? Where can that go wrong?
touch is such a integral part of human development and of who we are,
Yeah.
and so that it's just essential for relationships, for um, and for healing. And in psychedelic therapy, clients sometimes will go to preverbal states that preverbal trauma can come up time when there are no words, and sometimes the touch is really the only way of
Mhm.
communicating. And um, and so there is this great opportunity that working with touch presents. It's for helping the safety in the session, for uh, creating a new relationship to touch, and to really help with attachment and developmental trauma treatment. Also to help finish unfinished motor movements or kind of provide support in those processes. But at the same time, as you're saying, we have to be very careful when we use touch, and it's important that the therapists have training in the use of touch, and that includes an extensive consent process, which includes thinking about the power dynamics, to kind of bringing in cultural aspects that different people might relate to the use of touch differently.
Yeah.
And then, is the person actually able to give consent? Not because of the medicine, but maybe because you're the authority, and they believe that if this is for the healing, they want to say yes. So
Yeah.
there is kind of an ongoing process of you know um, um, consent for when we do use touch. And so I talk about somatic work. I kind of bring in that idea that the body keeps the score.
Mhm.
Vessel van der Kolk's book, but it really kind of helps to understand why the body is so important,
Yeah.
and then how the client can feel in their body, kind of how they're aware of their sensations, emotions, their impulses, and then we are coming to that consent. Can they say yes and no? And sometimes we practice that um, in the sessions, and then I want them to understand how touch could be useful in sessions,
Yeah.
and um, I don't
Yeah.
just kind of thinking about the different types of touch. That there is a safety touch. That it's something like helping the client to go to the bathroom, or if they were moving and you want to ensure their safety. And so that is a type of touch that all my clients will need to agree to in order to move forward with doing sessions. And then there is a supportive touch, which is something like a holding the client's hand or putting a hand on their shoulder. And the way how we think about it is that the touch is in this moment, and any intervention, any words would be to help the client to stay with what is and to provide support, not to change something that's happening. So it's not to soothe them or to move them from what is coming up. It's kind of used as a support, and sometimes clients might ask, can you hold my hand as the medicine's coming on? And then they kind of go into that. And then touch as a technique that we talk about, where we use different interventions as it emerges in the session.
Yeah. I mean, it's people now. I've been doing CAP full time and teaching and training since 2019, and people are often surprised when I'm like, I'm actually touching my clients more often than not, like with consent and with training and with intent. But I'm just like in the bubble. I mean, I'm putting my hand here, or here. I mean, there's just a lot of, and the reasons for it, I think it's really, nuanced, but it is interesting. And I'll just say this to people who might be listening, like, it's also okay to get used to it, right? It's like, you do get used to it, and you do learn a process about how to educate the client and to get client consent to where it really just becomes an integral. And I think it's an essential part of the process. So, so I was hoping we could switch a little bit to talking about MDMA and CAP, and just, not that many people have had the opportunity to do both. Like, I've been to the MAPS training, but I haven't seen any actual MDMA clients. What are your thoughts about similarities and differences? And where's that going to go?
Yeah, it's a question. It always comes up, and they're very different medicines, but we are accessing this expanded state of consciousness, and so they can facilitate the healing in similar ways. Yeah. And there is a different signature of ketamine and MDMA, so that there are some characteristics of the work which are different. Where one of the easiest one to imagine is just a time frame of the session. That the MDMA session, we would be with the participant for 6 to 8 hours, where our ketamine sessions are 3 hours, and some sessions even shorter in other clinics. So there is kind of a less of the time, and the ketamine sessions you will do more frequently. So there is kind of a different way of the treatment plan. And then the signature of the medicine, where the ketamine provides kind of the spaciousness, maybe distance, but really depending on the dose, so that with ketamine you can really also modify kind of the dosing you're working with. And then MDMA is an empathogenic drug with some kind of stimulant properties, and really brings the person in this empathic kind of state, open-heartedness, and calming down the amygdala, so that calms down the fight or flight or freeze response. So often I talk about kind of expanding the window of tolerance, where clients can access their traumatic memories and experiences without going into the state of feeling overwhelmed. And that allows for greater processing of the trauma. So the principles of the work, are similar. The way how we do ketamine-assisted psychotherapy, it's an inner-directed approach that's following the client's process. And what's really beautiful is that there is this. It's kind of moving away from the pathology. It's a moving away from the pathologizing the client, pathologizing their disorder, and kind of stepping away from the role of the expert. Of course, you're the expert in knowing, how the session looks, what the medication can do, what, kind of are the interventions. But then you're following the process, and client is the expert of their experience. And
Mm.
so these guiding principles, are similar in both of these medicines. And so, the process is similar, and there are some of these characteristics that are different.
Yeah. So this is kind of the $1 million question, having done both. Like, what is CAP not that
Mhm.
MDMA is?
Yeah, and the work I've done with MDMA was in the clinical trials, which had very specific protocol,
Mm.
and it um, has been an integral, really incredible opportunity to work with trauma, and the results of the studies show how effective it has been. And
Mm.
so being able to sit there as a researcher and see um, the shifts that happen to our participants has been, um, really uh, unlike anything else I've done.
Mhm.
And um, we work with PTSD and trauma with ketamine as well.
Yeah.
The process looks a little bit different, um, and I think for some clients is that they appreciate the shorter sessions so that it
Mm.
kind of is a little more titrated.
Sure.
Um,
Yeah,
but
I
I think
agree. I
both
mean,
are
it's
beautiful
easier to fit
approaches.
into a clinical practice, that's for sure. And, people can go about their day and so it's just interesting because I do trauma work with ketamine and follow similar things with MAPS protocol. And I'm always just kind of like, what else, just really curious about that ongoing conversation. And I really appreciate you for really, being one of the pioneers of that. Because when I first came into the ketamine field, it was like, no, we don't do ketamine for trauma. And I was like, kind of, why not? And so, thank you for that. So, that brings us to just a piece, and we don't need to spend a ton of time on this, or we could, but, mindful of time. And, there was a recent New York Times article in which you were featured, and about the MDMA, and it was about some of the controversies about, some of the criticisms leveraged at the research and groups that had that, essentially had a lot of power and really derailed, what in my opinion, I'll just come right out and say it because I don't have to not be biased. Like, that was really good research. And in my opinion, it should have been approved because it was well planned. It was a 20-year type of control. The criticisms that were leveraged are things that are endemic to psychotherapy outcome research. And, that's a whole nother set of conversation. But, I appreciated your courage in that article for really coming out and speaking to some of that and some of the controversies. And I'm just wondering if there's anything that you want to give voice to about that.
Bringing up this article that I think has been really important to bring some of what has been happening around the clinical trial and the approval process.
Right.
And
I mean, that was
um,
just straight up courageous of you to, give that interview and to be in that article because I mean, I just appreciate that, there's got to be some fear and some nervousness around that because some of those forces that are against that have been pretty negative, pretty harsh.
in the interview has been specifically about uh, false allegation, you could say, or misrepresentation of what has happened. And I have a chapter in the book where I talk about somatic therapy,
Mm.
consent, the types of interventions, and I am describing one of my client sessions in a ketamine session. And part of that session, um, taken out of context, was presented in the FDA hearing
Mm.
as something that I have supposedly done in an MDMA session,
Mm.
and it was misrepresented. Um, and so it has been very confusing, um, and so there was this opportunity when New York Times asked about it to share more about this experience.
Yeah, great. I mean, thank you for doing that. Like, because it gave, just people like me a window to even talk to just people in my general community, who came to me and they're like, tell us about this. Like, these things seem, because again, at face value, it's like, yes, we don't want to hold people down and, all the different criticisms, but it gives an opportunity to understand that there's really a lot more of the nuances to the whole process overall. So, thank you for giving voice to that.
A really difficult thing about it was that there was this misrepresentation, sharing about um, uh, essentially doing something to a client against their will. It said that I pinned down a client, and um, of course, absolutely, that did not happen.
Right.
Um, and I never described that also that happening. But somebody who reads that uh, might believe that that is true because they might have no reason. They might not have access to the book where I described a chapter.
Totally.
And they might believe that a therapist who's been extensively trained and who's been watched on video and supervised has violated a client in this clinical trial. And, violations can happen and have happened, but it was, quite confusing and shocking that this was represented in this way. Yeah, and so, as a response to that, Lycos had reviewed all my videos, all my sessions again, because you're, being watched kind of as the sessions are happening. And then there was a record of these sessions, and they acknowledged in a letter that there hasn't been anything of concern to, what was available there. So I, of course, knew that, but it was also good to have, kind of that there is this process that happens.
I just think that's really, really important for people to understand that, the use of pressure is a very intensive, it's a very intentional clinical intervention that is specifically designed, to work through a variety of different clinical issues. And I use it, we use it, like it's very common. And so, that is not holding somebody down. And yet we also need to be really mindful about having training and awareness and a high degree of intentionality in the way that we utilize such things as well. So I'm just grateful that you gave that some voice. So thank you for that.
And it's always a way of never overpowering the patient, so when you're putting the pressure, it's always to allow them to have the strength. So it's kind of like a helping, and so in the beginning the client might just have no strength because they're in the freeze response from something that happened, and they kind of like, and so then my hand is very like there's almost no resistance or no strength at all. And
Right.
as they're getting a little bit more, then there is a little bit more, and then it kind of moves from the freeze sometimes to more of that energy of a fight where they have the ability to feel their strengths and the ability to self-protect, for example. And and then we oftentimes invite a voice. Can you make a sound? Are there any words that go with that? Is there something you would like to say? Is there something you would have like to say to the perpetrator? For example. And so the client might also get back their voice, because part of the trauma is that the clients are oftentimes silenced and not that they're frozen in their body, but also in their expression. And so then they're able to kind of get their voice back. And, there is oftentimes release that's connected with that. That might be crying, that might be sweating, that might be shaking. And there is a completion of this unfinished motor movement. There is a release of this energy that was held in the body. Yeah. And so it's such an important part of the work. And right. And I think it's important to have a person rather than, for example, pushing a wall, because the wall does not respond, right? It does not move. And right. So it can be helpful as well at certain moments, but if you're there and you're able to be with them and they know you're the therapist, they're their client, they're in a safe space, and they're getting in touch with something that's challenging, so that it's kind of this safety of feeling these difficult feelings, and being able to move through that and process it is a beautiful gift, if it's a non-medicine session or if it's a medicine session.
Well, a beautiful gift is a beautiful way to say that, because I read that article and I was like, oof, like, what if there was a world in which that was somehow made like not okay? Because I personally find it to be a huge part of the clinical work that I do. And so once again, I appreciate you for putting yourself out there and giving us such a great explanation, both in that and also here. So thank you for that. So this is my last question for you. What would you like to share with the world? Like, what would you like to, share with people about either about the field or something that people might not know about you, or, what would you like to share? And, if you also want to kind of end and tell us about any upcoming Polaris trainings, that would be awesome as well.
Yeah, thank you. I think it's just so important to be, doing this work, sharing information, getting information, and for therapists to do their work. It's kind of, there's always new layers, and I think that is the most important thing. And my hope is that even with these, what I see setbacks in the process of working with the psychedelic medicine, that we are learning in the process, and that there is more therapists with proper training offering this work. And I'm excited about the future of the field.
Good. So am I. You said beginner's mind. I love that. Like learning how to stay in beginner's mind. Like, you still have a skill set, you still have an intention, you're still doing clinical intervention, but can we stay in that place of the inquiry and the curiosity and in that beginner's mind, like not needing to know? So it's an interesting dance. So where can people find you? How can they find out about Polaris?
Yeah, so polarisinsight.com is our website. There is information on the clinic, on me, on other therapists who work at Polaris, and then there is the Polaris training, which also is through polarisinsight.com. And we always have new modules offered. There are the experiential trainings about 3 times a year. The next one is in August. And we also provide consultation and supervision. So that's the best way to find us.
Good. Well, thank you so much, Veronika. I really appreciate it. And thank you, everybody who was listening. And we'll stop here. Thank you again.
Thank you for having me.
Thank you.
Thanks for listening to Living Medicine. We'll see you again next time. Be sure to click subscribe to get future episodes.